Okay, let's talk a little bit now how CRMA results assist you with your referral relationships. So a lot of doctors in the injury market will have referral relationships. These are either relationships with doctors, or relationships with lawyers, and relationships with your own patient. Now, your own patient can be your biggest source of referrals. So first of all, how does it assist you with referral relationships? Well, it is the only way to determine how badly damaged the non-disc ligament injury is. And most spinal injuries are ligamentous in nature. So it's a key test to be able to tell you how damaged the patient is. So any referral relationship, whether it's, in my experience, whether it's an attorney relationship, or it's a medical doctor relationship, or it's a medical specialist relationship, or it's a relationship of a referral from an already existing patient to you, one of the biggest things that they're referring to you is for your expertise in the injuries. And part of the expertise in injuries is really threefold. One, identifying the injuries and imaging whenever it's possible. And that's one of the biggest things that CRMA does, is it images the non-disc ligament injury, tells you how much excessive motion you have, tells you how much spinal instability you have when you clinically correlate it. Now, that being said, that assists everyone with documentation. Whenever a person's in an injury, there has to be documentation to support the level of injury. And remember, injuries are all derangements of a body part, and the more deranged the part is, the more damaged it is. The more herniated the disc is, the more damaged the disc is. The more excessive motion there is, the more non-disc ligament damage there is. The more separated the bone is, the greater the fracture is. So injuries are determined by the amount of derangement, how bad, and where is it, and what tissue is it. So whenever you're dealing with some sort of referral, they're dealing with your expertise on, one, the injuries, two, you're diagnosing them, and the biggest thing is, especially in a injury state, you want to image them. You want to document that really well, because that helps everybody involved try to determine what are the benefits. And then the third thing that you want to do really well is you want to be able to get really good results with these conditions. That's what all testing is about. Early testing should lead to better recovery results. And that's where you want to be. So how does that help you with your referrals? Well, when you do a really good job, you're very valuable to attorneys, you're very valuable to medical doctors, you're very valuable to medical specialists. If you are a medical doctor, you're very valuable to the conservative care providers, you're very valuable to the physical therapist, and you're super valuable to the plaintiff attorney, and super valuable actually to the insurer again. Especially if that third function is there, you get really good physical recovery results, because that's what everybody is depending upon in the market. And CRMA assists you with that aspect of basically helping you identify how damaged the non-disc ligaments are, because there is no other way to do it, and it should be done whenever possible by an unbiased, independent radiologist who's doing the measurement study. But that's how a CRMA assists you with your referral relationships.